Are you a parent and you've seen all the headlines in the news and online about the parasite that's been wreaking havoc in parts of the country? Well, this post is for you, and I really hope it helps allay some of your fears. What we're talking about is a parasite called Cyclospora. It is a parasite that attaches to the lining of the small intestine, and in doing so, it blocks absorption of water and other nutrients in the small intestine. That water is not absorbed, proceeds onto the colon, and then exits as explosive, very watery diarrhea. This can last for days to weeks. It can be associated with bloating, with some cramping, with some nausea, fatigue, due to how long this illness can last. The main thing that separates this parasitic infection from your typical stomach bug is its relapsing nature. It can create diarrhea for a few days. You think your child is getting better, a few days go on, and then here it comes back again. So that relapsing and recurring nature is the thing that I want you to remember. That should help you differentiate, is this my typical tummy bug that sometimes we deal with, or is it something more? So if your child is not seeming to get better, or if it keeps recurring and relapsing, if your child is seeming to be on the dehydrated side, they're not urinating as much as they should, which should be every 6 to 8 hours. If they're looking very fatigued, anything like that, I encourage you to see your pediatrician. There are stool tests that we can do to test for this parasite. And the best news is that it's treatable, and we use a very common antibiotic that we use very frequently in pediatrics to treat it. So we are noting that the parasite is mostly being spread via contaminated produce, herbs, and bagged lettuce, but also in some berries. It is not spread person to person. You don't need to pull your kids out of daycare. You don't need to avoid outings. Sometimes it can take up to a week to create the illness, and so it's hard to track where the source was because it's been over a week. It's hard to remember that far back of what you've had to eat or where you bought your produce, etc. That has made it a little bit more difficult to track the sources of the parasite infection. We're mostly seeing it in Michigan and Ohio right now. There have been some reported cases in the Southeast, including the state of Tennessee, but not in large numbers. Ways that you can help protect your family and prevent it is washing all of your produce, washing your berries. Cooking the produce is a more surefire way of killing the parasite. Always washing our hands as well with warm soap and water, singing happy birthday to yourself a couple times. Don't waste your money on all of the parasite cleanses. I know they're all the rage right now on social media and online. They have not been shown to be effective to prevent this or to treat this parasite infection. If you have concerns, please reach out to us. But at the end of the day, remember that this disease is rare. Your child most likely will not be infected. If they are, though, it is curable. We are here if you're starting to notice signs of dehydration, or if you're just kind of on the fence if this is what you're dealing with or not. I know the headlines in the news can be scary and it's easy to jump to conclusions and worry, but please don't do that. Just give us a call. I'm happy to walk you through that. If you're worried about it, you think your child may be dealing with this, bring him to see us. There are specific tests we can do, and like I said, it's treatable.